Hey everybody, Travis Sterling here. I'm the owner of Sterling Physical Therapy in Pella, and I'm here at Anytime Fitness with Barry Westerkamp, the owner of Anytime Fitness, and we're just going to talk a little bit about how we work together, why we work together, and what it brings both to my patients and Barry's clients. So as you may or may not know, our clinic focuses only on orthopedic, sports, and workers' compensation cases. We're the only clinic in the area to do so. Typically after formal physical therapy is over, we're always encouraging our patients to get going in some sort of fitness program. Obviously, we take a lot of ownership in our patients and we want to send them to the best. So we've developed a relationship with Barry and his staff where we can send patients over to him either when they're working with us or afterwards. And we have a lot of trust in Barry and his staff to know that they're going to do what's appropriate for the patient and take good care of them. So one of the big questions I get from patients is, I've had an injury, I'm concerned about getting going again, maybe I've never been part of a gym, etc., and I'm concerned about doing it. So can you talk, Barry, about how you and your staff kind of open up the doors to patients like that and make them feel at home?
Yeah, well, the number one thing that we want to do is make sure that the patients that you're sending us, we make them feel at home right here. And we know that a lot of people have never been a member of a fitness center before. They've never been to a gym, and they're not really sure what goes on in a gym. So we want to make sure that we meet them right where they're at, so we know specifically what it is that they're wanting to accomplish. And then we're going to walk them through the facility, get them started with a program that we're sort of in conjunction working together with to make sure that they're staying up with their exercises that you prescribe them. We're not taking them down the road to getting injured again. So us collaborating together for their best interest, obviously we make sure that they're aware of that, but just making them feel at home. This environment for a lot of people can be intimidating. So the number one thing that we do is just provide more guidance to let them know that, hey, we're going to help you get results, we're going to help you out, answer any kind of questions that you're going to have, and just make them feel that this is the right place for them.
So one of the big things we're always interested in when we're working with somebody in the fitness arena is the type of training they've had and how that meshes with our philosophy. So can you talk, Barry, about your general philosophy and then the type of training that your trainers have?
Yeah, our philosophy is more of a movement-based philosophy. We know that a lot of people in their daily lives they just aren't moving enough. They're sitting behind a desk or behind a steering wheel or whatever it might be, and they're just not getting enough movement in. So the type of training that we do, it's more focused on movements, not muscle. So basically what that means is we're not isolating specific muscle groups. We're trying to get the body moving as one unit, fully integrated. We've got on staff here trainers certified through the National Academy of Sports Medicine, the National Strength and Conditioning Association. We're also, there's 4 of us on staff that are certified in the functional movement screen. So when we do start off a new client, we take them through that movement screen so we can assess how their body's moving. So yeah, it's a different approach than maybe the traditional gym setting, or maybe something that you've done in the past where it was sitting down on a machine and isolating one body part at a time. We try to get the whole body moving together as one unit.
And that's something as a clinician that I really respect from their side, and obviously it speaks to the same philosophy as our clinic, that we try to get people moving as quickly as we can, thinking about function versus just a random exercise or something, okay? So Barry, you've got a lot of different equipment, things set up here in this brand new facility. It's a ton bigger. I really like the space. So can you talk to me about, like, if I send somebody over here with arthritis in their knee and we say they can't go down in a deep squat, what are some options that you may show them and utilize with that?
Sure, yeah. One thing about that is, we will have people that come in, they'll say, hey, you know, Travis or Patrick, they don't want me deep squatting. But, you know, obviously anytime you're sitting down, you are actually doing that squat pattern or that motion. So we want to make sure that, you know, we're still moving correctly, but yeah, we don't want to be going down into that really deep squat. So we like to use the TRX suspension trainer as a way to sort of assist somebody or deload somebody when they're doing, you know, like a squatting type motion. We like to use the TRX suspension trainer anytime we're maybe starting someone off squatting and we don't want them going into that full deep squat, because when you hold on to the suspension trainer, it's going to basically deload or give you some assistance to help get you back up. So if I'm going to do the squat, and so I'm not going down into the full deep squat, but then I can come on back up, and if I need assistance, I just hold on to the straps and use those to help bring me back up. So this is a good way that we can start, you know, someone that maybe you refer out to us to get them strengthening their lower body without going into a full deep squat.
And that is really the key from my perspective, is that Barry's staff will listen to our recommendations and then kind of take those recommendations and apply it to the facility that they have here and take good care of the patients so that they'll keep moving and hopefully stay healthy over time.